A social protection system is normally taken to mean an integrated national portfolio of policies and programs to address poverty and vulnerability through cash or in-kind transfers, along with the requisite institutional and administrative infrastructure. Here we're concerned with public social protection systems rather than informal community-level support built around traditions of reciprocity, though these may remain important. Social protection systems have many objectives, often characterized in terms of four basic functions: protecting a minimum standard of living for those already experiencing deprivation, preventing deprivation through managing risks and increasing resilience to shocks, promoting improvements to livelihoods and capacities, and at societal level, working to improve social justice and reduce social exclusion and discrimination. Social protection systems have four basic components: social assistance, non-contributory transfers in cash or kind to individuals or households in need; social insurance, which are contributory schemes providing compensatory support against contingencies such as illness, injury, disability, death of a spouse or parent, unemployment and old age; social care services for those facing social risks such as violence, abuse, exploitation, discrimination; and sometimes included are labour market programs, skills building, employment promotion, setting minimum employment standards. Social protection systems have their historical roots in social insurance provisions for employees and their families along the lines of the International Labour Organization, ILO, Social Security Minimum Standards Convention of 1952. But these exclude the vast majority of workers in low-income countries who don't have formal sector jobs. The 1980s and 1990s saw worsening food and income insecurity in low-income countries, which was driven by structural adjustment policies, including privatization of state industries, dismantling of food and farm input subsidies and price guarantees, drought-triggered famines and food crises, and the HIV/AIDS epidemic. Governments and development partners responded with non-contributory social safety net programs, initially conceived as temporary measures to help the most severely affected. In time, these became central to a longer-term social protection strategy expected to serve pro-poor growth and poverty reduction aims. To date, most such initiatives have been designed as discrete projects, some large-scale and government-led, like Bolsa Familia in Brazil, or the Productive Safety Net program in Ethiopia, while many others have been externally driven pilots. But in both cases, benefits have been restricted to those identified as the poorest. Although social insurance coverage has also grown, especially in middle-income countries, social protection is now dominated by social assistance in low-income countries in Africa and South Asia, and to a lesser extent in Latin America with its several very large conditional cash transfer programs. But coverage remains low. Almost half the population in Latin America, 2/3 in South Asia, and 3/4 in Africa have no access to any form of social protection. After several years of growth, social protection expenditure as a percentage of GDP has shrunk in middle-income countries and stagnated in low-income countries since the 2008 financial crisis, and is now at 2 to 3% in Asia and Africa and 6 to 7% in Latin America. This compares with more than 15% in advanced economies. This does reflect similar differences in government tax revenues, which stand at 16 to 17% of GDP in Asia and Africa, 22% in Latin America, but over 30% in advanced economies. Social expenditure in general hasn't kept up with increases in unemployment and poverty since 2008. Within social assistance, there are different views on its purpose and approach, and these reflect different evolutionary pathways and ideological perspectives as well. One perspective is the extreme poverty focus. This is the safety net approach, as followed in Tanzania's Productive Social Safety Nets program, the Livelihoods Empowerment Against Poverty program in Ghana, Ethiopia's Productive Safety Nets program, Bolsa Familia in Brazil, and so on. Essentially, these are neoliberal in nature, rationing resources and targeting them at the most extreme poor. They're promoted by the World Bank mainly, but also with several donors buying in. Extreme poverty is defined in these programs in terms of national poverty lines and quantified in periodic national household surveys. Typically, they're targeted using community-based targeting, i.e. getting community committees established who decide on who are the most poor people in their community, combined with a proxy means test, which is scoring and ranking households based on observable attributes which are most closely correlated with income or expenditure in the household income and expenditure surveys, and then applying cut-off quotas. Often there's conditionality built around clinic and school attendance, with more or less punitive sanctions for non-compliance. The rationale for this is one of boosting human capital and preventing intergenerational transmission of poverty. But there's a subtext, which is to address popular but generally unfounded fears about dependency on handouts. They often feature public works, which is a further form of conditionality, with a rationale of building community assets, but also showing beneficiaries to be, in some sense, deserving. There's also a graduation ambition in several of these programs, meaning that beneficiaries are expected to become economically self-sufficient and exit the program through taking on businesses and so on. These programs have been positively evaluated in their own terms, but they do have several drawbacks. Poverty lines are often artificially low, and because they haven't been properly updated. Proxy mean tests are notoriously inaccurate and neglect changing household circumstances, while community-based targeting is open to discretion of local elites and socially divisive. Both are open to manipulation and data quality issues and are poorly understood by communities who tend to regard selection as a lottery. Conditionality may increase school or clinic attendance, but it hasn't been shown to improve education and health outcomes in general, especially where there are supply-side constraints on access and quality of services. Public works tend to be poorly organised and the generation of assets not properly evaluated. But the administration and labour opportunity costs of these programs can be high, with possible negative impacts also on child nutrition. Graduation hasn't limited caseloads as expected and tends to overlook the structural constraints which keep people in poverty. Administratively, these programs are very demanding. They're top-down, paternalistic. They do not help realise rights to social protection. And importantly, the large majority of poor and vulnerable people remain excluded. Contrasting with this approach is what I call a social security approach, which is more like social insurance, but it's non-contributory. For example, Uganda with its universal pension program, which is now being rolled out, and Lesotho, which has a number of universal programs. They're associated with the ILO's social protection floor recommendation, which was adopted by 185 states in 2012. Essentially, these adopt a life cycle approach, i.e. addressing vulnerabilities associated with life stages, such as motherhood, infancy, school age, disability, sickness, old age. The idea is that these programs can be progressively realized as resources become available, often with social pension as a starting point. They're universalistic rather than limited to the poor. This reduces exclusion. They're rights-based rather than discretionary, so that governments can be held to account. They cost more, but they're shown to be fiscally sustainable even in low-income countries over the longer run. They're more likely to engender political support and contribute to a government-citizen social contract, enabling requisite domestic revenue generation. Comparing these approaches, a poverty focus is usually judged as in principle more cost-effective in terms of reducing poverty as measured by the poverty gap with given poverty lines. But social security has broader aims than this, especially reducing vulnerability to income insecurity across the population as a whole and increasing social cohesion. In social protection systems, the two approaches can coexist, but in many cases they compete for resources. For example, in Tanzania, where the Productive Safety Net program has tended to crowd out other options such as the social pension. Outcomes depend critically on the effectiveness of institutional leadership and coordination and coherence, and the quality of management and of implementation systems. Recently, there's been consensus around the need to shift the focus to sustainable national social protection systems under government ownership and coordination rather than individual projects. Now, such a system-level approach allows resources to be channeled to social protection policy and strategy development, strengthening institutional capacities for coordinating management across multiple programs, building integrated management information systems and beneficiary registries, system-wide assessment and evaluation, and potentially avoiding gaps and overlaps in program coverage and improving overall coherence and cost effectiveness. To this end, the ILO and the World Bank have led the setting up of the Social Protection Interagency Cooperation Board, and they are developing a series of social protection system assessment tools. The ILO and the World Bank have also issued a shared mission for universal social protection concept note in 2015, which is about achieving universal coverage while leaving no one behind. This outlines an agenda for the next 15 years, which is consistent with Sustainable Development Goal number 1, which includes eradicating extreme poverty as well as implementing social protection floors and increasing coverage of the poor and vulnerable. But this will depend largely on domestic revenue generation among developing countries. It can't depend on aid. And this needs much more concerted international collaboration to reform tax systems, to address illicit financial flows, to curb corporate tax avoidance, to reduce debt obligations. Together, these challenges cost developing countries far more than they receive in development assistance. There's also a need to broaden social insurance coverage and contributions, including by finding ways to extend it into the informal sector.